thanks so much for joining us today. We're going to talk a bit about mental health, and you and I, Kayla, have been on a journey around youth mental health for my family, for your training and your education, and we'd love to hear a bit about the work that you do.
Yes, that's great. So that's also true. So my name is Kayla Bernard. I'm from the community of Spaganagity First Nations. I just completed my rec therapy degree at Dalhousie University with a focus around child and youth mental health. One of the few Mi'kmaq rec therapists in Nova Scotia. So my work really is bringing youth together as a community and kiddos together and having them rediscover art in a new way to support their mental wellness by learning basic coping skills like mindfulness, meditation, self-regulation, while also having fun and creating art together in a little community. We're just at Powerhouse Youth Center in the HRM now with our kiddos. So,
Great. Thank you.
Well, I know, Kayla, that you've done a lot of advocacy and work around youth mental health and mental health in general.
Yes.
And I know that you know that in other provinces in the Atlantic region that they have access to same-day, next-day walk-in mental health support, and that we don't have this in Nova Scotia. So we in the NDP are committed to providing same-day, next-day walk-in mental health support across the province. I wonder if, based on your experience and background, if you could say a little bit about what the impact of having that available, as you would see it, might be.
So having next day mental health services will save lives. Because the hard part about the province here is that it takes a lot of courage to access mental health support. So somebody has the courage and then they're told, oh sorry, you have a 2-month wait. That can put people's lives and safety at risk of children, youth, and other vulnerable populations like the BIPOC community and the 2S LGBTQ plus community. So having that next day services that can meet people when they're ready to get help will save so many lives of so many people across this province who shouldn't have not lost their lives because of our lack of access to services.
And we know too that with emergencies in mental health, that it happens not rarely that families or friends call 911, and that the service that arrives is police, and we know that this is often not ideal and it doesn't lead to ideal outcomes. So we're committed in the NDP to establishing a network across the province of emergency mobile mental health teams. So I'm wondering, based on your own advocacy and experience, if you could say a little bit about the kind of a difference that having that available across the province could make.
Using our police force as mental health treatment is not a trauma-informed approach. That actually traumatizes folks to then want to use the police services for other things when they actually need them, for like help with criminal matters or for their own safety. Having them involved in a mental health crisis when some are not trained in trauma-informed approaches just makes people scared, and then they don't want to ask for help again, and they don't want to reach out to the police for other matters. Having a trained team that can be accessible across the province would change our mental health access for people.
Well, that's great, and thank you for explaining this. And so I want to say that 4 days now from the conclusion of the election, one thing that all of our candidates in the NDP are finding, that as we have gone door to door in the course of this campaign, and we ask people to identify issues that are important in their household, one thing that we have heard as a repeated theme is not just healthcare in a generic way, but mental health care in particular being identified as an important area for people and their families. So we understand that this is an area of investment and improvement that we can't evade in Nova Scotia. And so to this end, we are committed in the NDP to bringing forward a comprehensive program of improvement in mental health care services, which has 3 foundations. 1, the providing of same-day, next-day mental health care services in a network across the province. 2, establishing a network of emergency mental health mobile response teams across the province. And thirdly, a commitment to moving to 10% of our overall health budget, according to the recommendations of the World Health Organizations, being provided to the area of mental health, because we know that mental health care is health care. So it's important that we're able to make sure that everyone in Nova Scotia understands that if the NDP on Tuesday is able to form the government of our province, the improvements in mental health care that are needed are going to be the improvements in mental health care that are going to be provided.